Okay. Hello, those following Ask Dr. Uthman YouTube channel, those following Ask Dr. Uthman TikTok, and those following all our social media platforms. Today we are live on YouTube and TikTok. And straight away we're going to be receiving questions from you. Today I'm not going to teach like I've usually told you. On my lives, I don't bring topics of my own, but I answer your questions. So bring any question of your choice and then we discuss that question. So today I'm interested in questions regarding fertility and pregnancy. I think I would really entertain such topics. And for those of you who would like to have a private chat, a private conversation with me, you can go to my website and book an appointment at www.druthman.com. Book an appointment. We shall be able to talk to you clearly, and it will be, because I value privacy. So I would wish to have a private chat with someone. Some information is not for. No, it's not fine. Some information is not to be shared on the platform, so it's better you book an appointment and we discuss. So let me straight away start with questions on YouTube, and those of you on TikTok also send your questions. Make sure that you share the live so that everyone can get the information. Those of you on YouTube, share the live. Do not be selfish. Share with other people so that they can get the information. There are very many people outside there suffering. They are failing to get pregnant. They have a lot of issues. So it's now time for you to share with them and they get to understand. So don't forget, those of you on YouTube, don't forget to subscribe if it's your first time to watch my channel. And also, I told you that we started the program of membership. If you'd like to become a member, please join. So straight away, let's go to the questions. And today we are going to have to be live for only 1 hour. So we are going to be very, very fast. Call your friends. We are going to be live for only 1 hour. So by 7:30 we shall be gaming. So number one, I will start with all these ones are greeting me. Hello doctor. All right, I'm fine. Okay. So Mumbahia Zephyrin, what could be the problem when the vaginal discharge is dark water? All right. So what's usually the problem when the vaginal discharge is talking about dark water? Now, we know that having a vaginal discharge is normal. Every woman has vaginal discharge, but the color has to be clear. A normal vaginal discharge the color is very clear. It's clear, and it doesn't have a smell, because actually that discharge, the normal vaginal discharge, is supposed to have a very pleasant smell or odor. It's very pleasant. I think we can't call a pleasant smell an odor or smell. I think we shall call it a scent. A normal vaginal discharge has a very good scent, and that scent is even attractive. That's why during ovulation, men are attracted to women because of that good scent. And I think when some of you studied biology, you know what they used to call chemotaxis and so on. So women have that, and men can be attracted to them because of that good scent. But now when you get diseases, for example, you get infections, the scent can change. So if you find that you don't have a good scent, you have a bad odor, vaginal discharges have a bad odor, just know that you have a problem. If your vaginal discharges are dark, they are not clear, just know that you have a problem. Now, if there are very many causes, for example, there is candidiasis. If someone has candidiasis, someone with candidiasis, they will have a white discharge, which is like curdled milk. I don't know if someone knows curdled milk. When milk is curdled, it's white, and again it's like, how am I going to call it? It's like, it once looked like yogurt. Okay, yes, I think yogurt is curdled milk. So that's how it looks like. And for a person, for For a normal discharge, it's supposed to be clear. But if you find that your discharge is like curdled milk, it's like yogurt, then that is not normal. Number 2, if the color changes, okay, if it becomes yellow or it becomes dark, like this one is talking about. So now, if you have such a discharge, Missy Namumbiaha Zephyrin, I don't know, where are you? Where are you from this name? I don't understand this name. But if you have that discharge, then you're likely to be having candidiasis, or what most women call candida, that I have candida. Then you're likely to be having chlamydia, you're likely to be having trichomoniasis, and so on. There is also bacterial vaginosis, and so on. So that is an infection and it needs to be treated. So how are you going to treat this infection? That is very important, because it's not all about just looking at just seeing the discharge, the color of the discharge, and then you start right away with treatment. What you're supposed to do is to go and do what they call an HVS. They do an HVS, or a high vaginal swab. They take a swab from your vagina. How is it gotten? A swab from your V. Someone enters. These people don't see what TikTok. Let's see this part. I want them to see here. Okay. This side. So, but you can put it back and demonstrate from here. So, if they want to do a high vaginal swab, remember this is the woman is okay. So if we are to do a high vaginal swab, an HVS, they get what they call a speculum. A speculum. A speculum is an instrument. It's one of the instruments we use in the hospital, and it will help to open your V. To open your V. So when you open the V, now we are able to see the whole length of the V. So now we get something called, you can call it a swab, or let me say, you can, okay, in a simple language, we get something like a spoon. And then we insert it there at the higher ends of the V. And then we scoop. We take off a sample and take to the laboratory. So when we take that sample, we are able to identify exactly which microorganism, exactly which bacteria, exactly which fungi, exactly which parasite is causing that discharge. And that's how we are supposed to do that. Now, when you're done with that test, then you can get medicines. At times, after doing this, we can decide to do a culture and sensitivity test. With a culture and sensitivity test here, we plant, okay? We plant, or we inoculate, or we get the sample you've given, we've gotten from you, and you put it on a culture medium. A culture medium is like the garden. Then we put that substance there in that garden, and we make sure that we grow. We find a way of growing the organism that is there. So after the organism has grown for after 4 days, the organism will have grown. We shall be able to look at the organism and understand which organism has grown. If it's E. coli, we shall know. If it's trichomoniasis, we shall see. If it's candidiasis, we shall. If it's candida albicans, we shall be able to see if it's candida albicans. Now, after seeing that, then we can test different medicines on those different bacteria, those different viruses, and then you can get treatment for your funny, foul-smelling discharge. Okay, so I think that question is done. Let's have another one. So I'm saying, hello doctor, I was diagnosed of hemorrhagic cyst on my left ovaries. After a month of treatment, I went for checkup, which shows it's finished. My problem is, please, can it affect fertility? Yes, of course. A hemorrhagic cyst, whatever type of cyst may be, can affect the fertility. especially looking at the location of that cyst. Where was that cyst? If that cyst was big enough to compress the fallopian tube, you may get issues with infertility. But however, when it is properly treated and you find that you no longer have that cyst, the cyst is gone, everything is gone, especially if the treatment was given early, you may survive infertility. You can survive infertility. But at times we take long, some of you take long to treat these cysts, and then they cause scar formation, they cause adhesions, they cause a lot of issues in the fallopian tubes, in the ovaries, and you end up with blocked fallopian tubes. You end up with blocked area, that fimbrial end that leads to the ovary. You end up with infecting the ovary and so on, and at the end of the day, you can end up with infertility. Let me have a question from TikTok. Someone is saying, Doctor, I'm one hope crowns. Doctor, I'm 1 month pregnant, yet in April I was diagnosed with molar pregnancy. Yes, what is molar pregnancy? Molar pregnancy is actually, molar pregnancy is some people will call it a tumor. It's a tumor. Someone gets pregnant, but there is no baby. There is on the mass a tumor which is there. Okay, you can call someone live here. There is a mass which is there, that tumor, and a molar pregnancy. If it has happened, it doesn't mean that it will continue like that. That every pregnancy you get, you'll be having a molar pregnancy, So if you're pregnant right now, Miss Hope Crowns, it's okay. You continue with your pregnancy. There is no problem. The other one happened. I know you got rid of it. It's fine. Then we can now proceed with another pregnancy. Let me have a question from here. Kelly Faith is saying, hello doctor, I was diagnosed of the Nama yanja Nuliat is saying, hello doctor, nze mbuuza lwaki wemba ne bba wange nvaamu amazzi agawunya ekisu ekibi. This one is saying that Nama yanja Nuliat is saying that every time she does sex with her husband, she gets funny water. Okay, some funny water or discharge comes out, and it is so smelly. But this discharge comes during sex. The discharge comes during sexual intercourse. Now, such a person is having still what we've been talking about. You may be having a PID, or you may be having, those are all STIs, or what, because if I say PID, I say UTI, I said it will confuse you. Just know that that is likely to be an infection. I would advise you to, number one, go and do a high vaginal swab. And in that high vaginal swab, they will do microscope, they will do some tests in the lab, including, and do not forget, doing a culture and sensitivity test. You will know what is causing that. And also do a blood test for syphilis. Sometimes syphilis or treponema pallidum can cause such. So Nama yanja Nuliat, genda wekebeze, you do a high vaginal swab and also do a syphilis test. You identify what is causing the problem. Mutoni Angelique, hi doctor. After using birth control for a year, for a whole year, then you want to get pregnant and try. This is not coming out clearly. Hi doctor, using birth control for a whole year, then you want to get pregnant and try for 1 year and a half now. The doctor gave me metformin and litrazole now. 6 months I have passed, I have been. Sincerely, Mutoni Angelica, I don't understand your question. I'm failing to get exactly what you're asking. Please, I ask you kindly to rewrite your question. I'll answer you. I'm not getting what you mean. Robbie Astarico is saying, does Jadel affect fertility? Yes. When Jadel, you're talking about Jadel. Jadel is a method of family planning. It's an implant, but for this kind of implant, once it is inserted, it spends 5 years. You can spend 5 years without getting pregnant. That is a Jadel. It can affect pregnancy. Yes, true. Why? Because it is hormonal. It is a hormonal method of family planning. That gel contains a hormone called levonorgestrel, which interferes with the progesterone, which is the hormone, the natural hormone progesterone. So this levonorgestrel will interfere with progesterone. Kaput! Infertility can happen. Then this one is saying, blessing a bill. Doctor, did the family planning change circle? Did the family planning change circle? I don't understand the question here. Billy, please, where are you? Where are you watching from? But let me understand your question clearly. Billy, really, I don't understand the question. Bestiwaka Miss 99 saying, Doctor, can a woman of 45 conceive? Yes, Bestiwaka Miss, yes, it is possible. A woman of 45 can conceive. I think you go to my YouTube channel. I asked Dr. UTHUMAN, one of the latest videos I released was about high levels of prolactin, and no, it was about low ovarian reserve and how to conceive with 45 years and above. So it's very possible. Of course, it's not just saying, let me go and conceive. There are things which can be done. Especially, number one, if you've ceased the menstruation, you have amenorrhea, you reach menopause, you're no longer menstruating, there will be some small little problems, but they can still be sorted. You can get treatment. Then when you're still having menses, then that is better. It becomes easy, so you can conceive. There is no problem about that. Good. This one is who? Esther who? Esther One New. These people on TikTok. Good evening, doctor. May I have a question? I have missed my period almost 2 months, but to test it's negative. Yes, missing periods, it is called amenorrhea, and we have two types of amenorrhea. We have secondary amenorrhea and primary amenorrhea. Primary amenorrhea happens when a person has never seen their periods. You've never seen your periods. That is called primary amenorrhea. And secondary amenorrhea is where it happens when you've ever had periods and all of a sudden stopped getting periods. And that usually happens as a result of, number one, fibroids can cause that. Number two, hormonal imbalance, especially if you have a problem with the progesterone, especially those women that use family planning methods that are hormonal like pills, especially the emergency pills. Some women use emergency pills unknowing because they don't use them well. You know, every time someone has sex and they don't want to conceive, they want to use emergency pills. But you should know that emergency pills have their limitations, and when you don't follow those precautions, then you end up with such issues of amenorrhea. Depo-provera, some women also use Depo-provera so much, or that injection that is given here, that family planning injection for 3 months, and that can also affect your hormones, and that can cause amenorrhea. And to some people, they get menorrhagia, heavy bleeding. Mercy Zangoso on YouTube, you're saying, hi doctor, it's now 11 months, I'm not conceiving after a miscarriage. Sorry about that. Now, after a miscarriage, we need to understand what happened. What did you do? Because when you had a miscarriage, how was it managed? Okay? How was it managed? What caused this miscarriage? Okay? Because what causes a miscarriage can actually cause infertility. So mind about that. What caused that miscarriage? Number two, you may find that the miscarriage happened and it caused... it's okay. You may find that the miscarriage happened, but it caused scarring in the fallopian tubes at the location where it was. You may find that the miscarriage happened and it caused scarring, it caused adhesions. So you may get those problems. So a miscarriage, after miscarriage, you need to do fertility tests. Try to carry out tests to identify the reasons as to why you are not able to conceive. Nkotani ST, yes, how are you, where are you calling from, and what is your problem? Please try to speak English, please, kindly.
Okay, my name is Steven.
Yes, Steven.
From Kigali, Rwanda.
Yes?
I have a question. question concerning those family planning things.
A question concerning family planning.
A 3-month injection thingy, family planning thing.
Please be a little bit loud. You're saying you're asking about a 3 months injection. Nkotani, please.
3 months now since
Mr. Nkotani. Ekibuzo kyo kigamba kitya? Obuuza injection ya 3 months. I ask you to get off and call back because you don't have good your network is poor.
No, there's no.
Mujeko. Your network is poor, call back. Damo sabe tujja kuyita network ayonfu sikuli ya bulungi. Let me get someone else. Call back please. Yes. Right. Okay, Tracy Wasi, how are you? Where are you calling from and what's your problem? Be loud.
Hello?
Yes, please.
Hello?
Yes, please. Where are you and where are you calling from? And be loud.
Doctor?
Good evening to you. How are you?
From Botswana.
From Botswana, the Swan people. How is Botswana? How is South Africa?
Sorry?
How is Botswana? How is South Africa? Not South Africa, the country, but Southern Africa.
So, where are you in?
We are in Uganda. What's your question? You have a question about fertility?
Yes.
Please go on and be fast.
I've been missing my period since February.
You do what?
Since February.
You've not been seeing your period since February.
Missing.
Okay.
Yes.
Alright. Missing periods can be as a result of if you may be having a fibroid, you may be having problems like endometriosis, you may be having an issue of with hormones, that is low levels of progesterone or hypoprogesteronemia. All those ones can make someone to miss periods. What you are supposed to do, go to the hospital, do a pelvic ultrasound scan to rule out a fibroid, rule out an endometriosis. After that, do a fertility hormonal assay, do a hormonal test, and make sure that when you're doing a fertility hormonal assay, you don't forget a hormone called progesterone. You don't forget a hormone called progesterone, then you'll be sorted. Is that all you wanted to ask?
You said it? It looks like your network is very poor.
My network is okay, it's yours. I've told you, go to the hospital. It is likely to be a fibroid. If it's not a fibroid, it is a problem with your hormones or an issue with endometriosis. So you go to the hospital, do a pelvic ultrasound scan. It will confirm whether you have a fibroid or not. If you don't have a fibroid, then it will confirm whether you have endometriosis or not. Then after that, go and do a fertility hormonal assay. Especially don't forget a hormone called progesterone. Is that clear? I want to leave you and go to someone else.
Okay, no problem. Thank you so much.
Welcome and say hi to those Botswana people. Johnny, first wait, mute yourself. I'm coming for you. Let me first answer questions from my colleagues on YouTube. I'm coming for you, Johnny. We have a question here. What could be the, just blessing a bit saying after I did family planning, my menstrual cycle changed. Why? Yes, if you did a family planning, which is hormonal, especially implants, Depo-Provera, and pills, they can change hormones. So you have to deal with that. Yeah, it's likely to be that these family planning methods interacted with your hormones and they caused hormonal imbalance. So that is where the problem is. Tabu Stella, good evening. Doctor, good evening to you. Doris Liwing is saying, I'm 40 years and I have 2 months without period. I need to get pregnant. I have already discussed about amenorrhea, what causes and what you're supposed to do. Do those tests, Doris Liwing. After doing those tests, we can now plan on how you can conceive. Let me go to, I'm seeing Jumba Brian is gifting us. Jumba Brian, you know him? Okay, so Joanne, hello, how are you? Where are you calling from and what's the problem?
Hello, how are you, doctor?
Fine, how are you? What's your name and where are you calling from? What's your problem?
My name is Joanne Chacham from Kenya.
Joanne Tal from Kenya, yes.
Yes, I've been struggling to get pregnant. I don't know what happened because I went to the doctor. I do some tests. They say my fallopian tubes are okay. I don't know now what's the problem because I've been trying something like 6 months now. Although I got a miscarriage 3 years back, and I have 1 kid. I don't know what's the problem.
You got a miscarriage 3 years back.
Yes, 3 years back.
Did you find out why you got the miscarriage?
Sorry?
Did you find out why you got the miscarriage? Why the miscarriage happened?
No, I just went there and then they washed me. I don't know. They didn't tell me now what was there.
So first of all, the miscarriage itself, the washing itself can cause infertility, can make you fail to conceive again. Because during that washing, they may have done a D&C, dilatation and curettage. With dilatation, when you get pregnant and you want to take out that baby, some people do dilatation and curettage. Dilatation and curettage is when the doctor enters inside with some instrument and scrubs the lining of your uterus. Now, sometimes that can cause injuries to the endometrium. It can cause injuries to the endometrium, and when the endometrium is injured, it can have scarring. There can be scarring. So when scarring happens, then you will be having problems with conception. That is number one. Number two, you may find that what caused this miscarriage was an issue with a hormone. So you have to still carry out a fertility hormonal assay. Number three, you may find that you have rhesus factor, blood group rhesus factor incompatibility, whereby you have a negative rhesus status and your husband has a positive rhesus status, and that will cause that. So I invite you, I ask you to go and run tests in that line. Then identify what caused the problem, and then it can be rectified. How old are you?
I'm 37.
37, it can be rectified. As long as we get to identify the problem, what caused that, it is easy.
They tested also my hormone imbalance. They are okay. They do scanning. They did ultrasound. They told me I'm fine. I don't know now.
Did you do an HSG X-ray?
Yes, they did.
And it said what?
They told me I'm okay. Imagine. Oh, I don't know what to do. I went to Medi.
It is unlike someone. Let me tell you this, colleagues, whoever is watching us on this live today, someone cannot fail to get pregnant for a period of 3 years, and then you tell me that everything is okay. Your husband is okay, the sperms are normal, you're having sex regularly, at least 3 times every week, you stay together for a period of 3 years, and you're saying everything is okay, but you're not conceiving. I will not accept that. There is a problem. There is something wrong. There is something wrong. You need to carry out tests correctly and identify this problem. You can't fail to conceive when there is no problem. That has never happened.
Okay, is it normal for sperms to come out? Because like mine is not passing cervix or what? I don't know. It's something like that.
Someone saying sperm is coming out, that is normal. And that is your last question, I hope, because I want to go to YouTube and answer these people. Now, some people think, you see, let me show you this clearly. Now, when you sleep with your man, he will deposit sperms here. Okay? He will deposit sperms here. Are you saying that?
Yes.
He will deposit sperms here. And the moment sperms are deposited here in the vig, the moment they are deposited in the vig, they run so fast. They swim so fast and enter the cervix and proceed to where they are supposed to go. So by the time by the time you're done with sex, maybe you're waking up, or by the time you're checking, sperms have already entered. They won't come back. They have already entered. What you're seeing outside there may be semen and maybe some of his sperms, but most of them would have entered. They are so fast. So that is the same issue I talked about here. Some women thinking that when they have sex, actually there's still that notion of women thinking that when you have sex while you're standing, you cannot conceive. That is not possible. That is not true, I mean. When you have, as long as you've had sex and a man has ejaculated here, even if you stand very fast, some people say you stand up very fast, sperms will not enter. Some they will enter because they are so fast. And therefore, that is not a problem. What you're seeing outside there, the sperms have already reached where they're supposed to go. So I think that's all I will take from you. Let me have some other people from YouTube to ask their questions. Thank you so much. Say hi to the Kenyans. We are now answering Archie Roosevelt Matu. He's saying, hi doctor, what's the best option in treating premature ejaculation? Premature ejaculation. Now, with premature ejaculation, I will still come to tell you that you need to first understand what is causing this. Some people get this premature ejaculation just because of nervousness. Okay? Some people get premature ejaculation because of nervousness, because of that too much love. You've just met someone. You know, there are some men who even ejaculated before entering. There are some men who ejaculated before entering. Okay? So, at times it's as a result of the nervousness. Sometimes it can be a problem with the muscular weakness, the cavernosus, the spongiosum, those muscles of the penile tissue. It can be a problem with that. It can be a problem with the nerves. Okay? It can be a problem with the prostate, and so on. All those ones. It can be a problem. You may be having hypertension. Okay? The microvasculature complications can cause that. And so on. There are a lot of issues. So one is to identify, to find out any of them, what is causing that, and then you can find a remedy. Sahil John is saying, doctor, the volume is low. Our volume has a problem. Esper. Alright, it is going to be rectified. Mohammed is saying, can it lead to infertility or not? That dark discharge. The dark discharge may not. When it's still acute in its acute phases, the dark discharge may not cause infertility. But when it stays there, it stays for a long period of time, not treated, because it can cause some other things. It can cause it can cause PIDs. It can cause scarring of the fallopian tubes.
Hello.
It can cause. Hello, how are you? What's your name and where are you calling from? Hello, what's your name and where are you calling from?
What? Sorry?
Do you have a question, a medical question you're asking?
What?
All right. So, this is a platform where people are asking their questions, so you can leave, and then we have others who want to ask medical questions. So we have someone saying, Kish, doctor, I've diagnosed with blighted ovum. I was diagnosed with a blighted ovum. It was my first pregnancy. Is there any chance that blighted ovum may happen again? Yes, there are still chances that you can have a blighted ovum, but there are also chances that you may not have a blighted ovum. So, For you, what you're supposed to do is to go on and conceive again. Either the brightened ovum, but actually the highest chances are that you won't have a brightened ovum again. Okay, so just go on and conceive. Miriam Blessing, hello, good evening, doctor. What causes pain during sex? Pain during sex is caused by a PID, pelvic inflammatory disease. And actually, when one of the tests, that one is, when we are checking for PID, we do what they call a digital vaginal exam, and that assesses for cervical motion tenderness. And when there is cervical motion tenderness, PID confirmed. So that is a PID. Yes, Stephen, how are you? I hope your network is now fine. What's your question? Stephen Nkotani, how are you and what's your problem? Be very fast. Yes, what's your problem? Okay? She used the Depo-Provera, yes?
Yes. No periods, no getting pregnant.
Alright, thank you so much. So he's saying that his wife used the Depo-Provera. That is a 3-month injection, and it's now 10 months. She's not seeing her periods. What could be the problem? Now, Stephen, just understand that Depo-Provera is a hormonal method of family planning. Your family planning elimwe dagala. And that medicine, that hormone which is contained in this Depo-Provera is similar to the natural hormone which is progesterone. Eyo empiso gye bakuba mukyalawo erimu eddagala erifaanana hormone ey'omu mubiri ereeta periods. So bw'egikyankalanya, if this hormone in the family planning interferes with the natural hormone, the woman may fail to get her periods. So that is Depo-Provera. What you're supposed to do is to go and do you go and do progesterone test. Find out the levels of progesterone in your blood, then that's how you will be able to treat. Engeri gy'ogenda okikolamu, genda okole tests eya fertility hormone assay, teweerabira emu ku test gye bayita progesterone level, olabe levels of progesterone, then we can start from there. Nsuubire Mr. Stephen otegedde. Alright, have a nice time. Blessing. So Kozi, I'll come for you. Just hold on there a minute. Let me first answer a few people here on our YouTube. I don't want these people to miss on our YouTube. They are very good people. Kenzie Keshi saying, what medicine should I use? Kenzie Sheki on YouTube, you're saying, what medicine should I use? I'm 3 months pregnant, but I feel too much gas in my stomach. Every time I am hungry, I feel like vomiting and so dizzy. 3 months pregnant, you're having gas. That is likely to be PUD, peptic ulcer disease. You're likely to be having ulcers. Now, what you're going to do, go and do an H. pylori test. Find out, confirm if you have ulcers. But also, even if that H. pylori is negative, even if the H. pylori is negative, but you still have these signs plus also epigastric pain around this part, around the epigastric region, that is likely to be ulcers. Now, you need medicine for ulcers. And the best medicine during pregnancy, I've not said when you're not pregnant. During pregnancy, the best medicine for ulcers is omeprazole plus any other medicines. But the best PPI there is omeprazole. For it, it is not contraindicated. For it, it can be taken during pregnancy. Other common PPIs, for example, lansoprazole, esomeprazole, rabeprazole are contraindicated in pregnancy. Some people look at omeprazole, or most of you are seeing OCID. Some of you look at that medicine and feel like, this medicine is weak. Every time I get sick, they give it to me, so it may be weak. Let me use these stronger medicines for ulcers. My friend, they are not allowed to be used in pregnancy. It's only that is used. Okay, Aminat, you're saying what? Aminat is saying, hello doctor, can someone ovulate 2 days after periods? No. Ovulating 2 days, yes, it is possible. Yes, if you have a short menstrual cycle, length, if the length of your menstrual cycle is short and you have longer periods. For example, if you have a 21 days cycle, and you bleed for around 5 days, then you have periods just 2 days after menstruation. Yes, it is possible. This one is saying, Nachimera Pamela, YouTube, you're saying, hi doctor, thanks for everything. My question is, what brings milk fluid in female private parts? Is it harmful? If, how to control it? Fluids, I told you fluids, you have to look at the color of fluids. The color of fluids, but I said that most of them are infections, for example, candidiasis, for example, chlamydia, trichomoniasis. Those are infections, and most of them are sexually transmitted. What I said is that go and do a high vaginal swab. They do microscopy tests in the lab. They also do a culture and sensitivity, identify the problem, get treatment. Let me get to Rukaya. Rukaya, how are you? Where are you calling from? And what's your problem? Be very brief and fast. Be loud.
Hello, good evening.
Good evening to you, and be louder.
Okay, good evening.
Good evening to you. How are you? Where are you calling from,
Now
and
my
what's your
problem
problem?
is, yeah, I'm Rukaya, I'm in Nairobi.
Rukaya in Nairobi.
Yeah. Now I have problem for not having my period. They can delay. I went to gynecologist. They give me medicines. They sent me for some tests. Then they said I have a ovarian cyst. Now the gyna sent me to take some medicines. Now I'm through with the medicines, but I've not yet received my periods. Now I don't know what now can I take so that
Alright, Rukaya, let's go slowly. Let's go slowly. You went to the hospital, they tested, you had a cyst. Okay?
Yes.
And you had a treatment. First, go back and confirm whether the cyst is gone. That is the first thing. You took the medicine, now you need to go back, confirm whether the cyst is gone. Okay?
Okay.
After confirming that the cyst is gone, because I don't want to contradict with your doctor, the doctor who is managing you. Right now, he may be doing things systematically one by one. So he started with the cyst. If the cyst is gone, and he confirms that the cyst is gone, he will give you some months, like 1 or 2 months, in order for you to resume your periods. If you don't resume your periods, then you may need to do other tests. The tests which I know you'll be able to do is hormonal assay, and we'll check for the levels of progesterone. I know.
They did hormonal analysis. They did.
And what was the level of progesterone, low or high or normal?
I don't know how to read them. I don't understand the language.
Then you ask the doctor. Find out from him whether the hormones were normal.
Okay. I may send you the results for the hormonal analysis. For even I went for unblocking tubes.
You see, you're going far. We need. Okay, you did an HS scan, the tubes were blocked?
Yes.
Okay, so you unblocked the tubes?
Yeah.
But you see, tubal blockade, tubes that are blocked, that doesn't cause amenorrhea. It can't make someone fail to get periods. Whether tubes are open or blocked, you'll have periods. Tubes have nothing. Fallopian tubes have nothing to do with periods. Someone can continue bleeding, can continue having menses, even if the fallopian tubes are blocked. So, I'm sensing that you're having 2 problems. You have a hormonal issue and a structural issue, which is tubal blockade. Unblocked tubes, that will help you to conceive. But again, with your periods, you need to do the other fertility. You're saying you have the results, but were they normal or not? Because we need to study the results. If they're not normal, you get medicines according to the results. Me, what I would encourage you, Rukaya, is to first be patient a little bit with your gynecologist who is handling you. He started with the cyst. If he did the fertility hormones, he knows the next step is maybe to deal with the hormones. That's my guess.
Okay, thank you.
Welcome and have a nice time. Okay, so let's go back to YouTube and we have Nachimera. Okay, Nachimera. Kwagala Madina, you're saying, Kwagala Madina, hello doctor, thanks for the work. I'm having a discharge when I'm about to be in my period. And even when I'm done, what should I do, doctor? Now, there are some people who get discharges either during their ovulation, or when they are about to have their periods. That has no problem. It is hormonal interchange, and there is no problem with that. You don't need any medicine. That is okay, and it is normal. Missy Kwagala Madina on YouTube. It is normal. Another question. We are winding up. We have less than 30 minutes to complete this show. So we have, I'm watching from Lagos. All right, say hi to the Nigerians. Wisdom Mike is saying, I got to hospital yesterday. Doctor said I have ovarian cyst. What can I do, sir? If the doctor said you have an ovarian cyst, then good, you're going to treat the cyst. It will depend on the size of the cyst. If the cyst is very big, the doctor will do surgery. If the cyst is small, then the doctor will be able to give you antibiotics. Miss Wisdom Mike. Sahel said, doctor, can hemorrhoids be cured after 10 years? Yes. Hemorrhoids can be cured by doing a surgery. A surgery is the only cure for hemorrhoids. The other medicines are they just manage symptoms, reducing, or by shrinking them and also reducing the pain and so on. The most reliable method is surgery. So, Miss Sahel John on YouTube, just know that hemorrhoid can do a hemorrhoidectomy. You'll get fine. Scovia Nantongo is saying, hi doctor, how are tubes flushed? Oh, how are tubes flushed? Tubes, of course, we mix a juice, we mix some fluids containing antibiotics, containing steroids and water. Steroid water. Put them in a vessel, call it a syringe, and then we get a cervical cannula. We get a cannula. Okay. Assume this is our cannula, this one. Then we shall pass it, okay? We shall pass it here through the vagina here, okay? And then when we pass it here, it reaches here. It is connected to a syringe which contains fluids of around 20 mils. And then we push those fluids so fast at a terrible speed up. And those fluids, because they are 20 mils and the volume of the uterus is less than that, then the fluids will be able to pass through or to unblock or to hit on the blockade and then open those fallopian tubes. That's how the flushing of tubes is done. Ruvarian, how are you and where are you calling from?
Hello, doctor. I'm Ruva from Zimbabwe. I'm the one you spoke to a few days ago.
You from Zimbabwe, all right. How are you and what is the problem?
When I called earlier, I explained to you my situation about missed abortion and this pain on my lower abdomen. And then, like I said, I went for scans. They said there's nothing. But I'm noticing that when I eat certain foods, that pain goes away. Could it be an ulcer or something to do with the gastro system? Because I notice that if I eat high fiber food, I don't really feel the pain anymore.
Thank you. You're becoming a doctor. Thank you. You have the answer, and that's all. Now what should I say?
So,
Kudos.
I'm
You have the answer. I can't add on.
so how do I treat it then?
No, you've already known that. You've already known that there is a relationship between the food and your abdominal pain. Now try to avoid, test those foods, try to avoid the foods that are causing that abdominal pain and eat those high fiber foods which do not cause abdominal pain. Simple. Not every time that you need medicines. You don't need medicines every time. Yes.
What if it's a cyst like you said?
No.
Can I try what someone...
No, it cannot be a
Try
cyst.
for
I insist, that cannot be a cyst. If you did a scan and they say there is no cyst, then it is not a cyst. It can't be a cyst and it is hidden.
Also, what I have is a gastro situation, nothing in my ovaries, according to the scan.
They said nothing in your ovaries. You don't have eggs.
I mean, like, the scan was saying everything is normal, no...
That's why I'm saying that if it is dietary, if the issue... Look, you see, sometimes we complicate problems for ourselves, by the way. Some of us want problems. Okay? If you see, Rovarian, you've already identified that this issue is related to the food you're eating. So just avoid that food. Just avoid the low fiber foods and you'll get fine. Okay?
Okay.
Yes,
Yeah.
do that. Do that.
Yeah, because the first time in a long time I haven't felt this pain. I'm actually trying this diet thing because I'm now overweight. So I noticed that when I started this diet thing, I've been eating a lot of carrots, a lot of vegetables, a lot of what, the things are changing. Although I was on my period recently, could it be that maybe the thing flashed out when I was on my period or what?
No.
I don't know.
No, that is wrong. What you said first is right and follow that.
Okay, doctor. I'll try to stick to the high fiber diet then. Thank you so much.
Alright, say hi to the Zimbabweans and say hi to everyone there.
Yeah, I'll greet everyone. Thank you so much.
Alright.
Why are you crying?
So let's have another question on YouTube. My guys on YouTube are waiting for me. This one is saying, what causes missed periods for 2 years after using Depo-Provera? Self-explanatory, it is the Depo-Provera causing missed periods, as because Depo-Provera contains a hormone. I repeat myself always because I know every time you get new people. So Depo-Provera is an analog of progesterone in blood, and it interferes with progesterone levels and thus causing amenorrhea or missing periods. Blessing AB is back, saying, Blessing AB saying, I did family planning for 3 months and I have a 28-day cycle before, but after the family planning, I started seeing periods 2 times or more in 1 month. Yes, Blessing, that is true, and it is very possible, and it is because the family planning you used, which is 3 months, is a hormonal method which interferes with the natural hormones in blood. This one is saying Skin is asking, please, how to reduce high prolactin. Skin, if you want to reduce high levels of prolactin, take medicines like bromocriptine and cabergoline. Mutoni Angelique is saying, this is Aminat saying, I started my periods on 15th of this month and I stopped it on 18th. Since yesterday, I started seeing heavy slimy discharge like ovulation and lower abdominal pain. Could it be ovulation? Yes, that's ovulation, Aminat. That's ovulation. You've listed the signs which are clear. That's ovulation. That's ovulation. That's ovulation. So you can do whatever you want. I know what you're planning, Aminat. So that's ovulation. Hi, Doc. Why do I experience painful ovulation? Ovulation is painful, yes, because of the hormonal fluctuation. During that time, there is high levels of luteinizing hormone, and that was asked after Safta BD23 names on TikTok. So pain during ovulation is normal. If you want to reduce it, just take painkillers. It's normal. You don't need treatment that you should take away that pain. It's normal to have that pain during ovulation. It's ovulation, yes. Then we have Bridget Eniema Women. Peter, this name, where are you from? Bridget Eniema Women. Where are you from? Tell us where you're watching from. Good evening, doctor. I am watching from Lebanon. All right. Please, can a woman over 50 years have an IVF? Yes. There is nothing that can stop a woman of 47 years to have an IVF. As long as we've done our serologies, we've done our tests, and the things are okay. So there is no problem. You can have an IVF and get a child. But hurry, because as your age goes high, the chances reduce. So IVF can be done even at a woman of 50 years. There is no problem doing IVF. Those of you who don't know, IVF is intravitreal fertilization, a process whereby we fertilize the egg using a sperm outside the woman's body. We do that from a test tube. We get a test tube, we put an egg, we put a sperm, fertilize, make to form a zygote. Then that zygote is kept in a test tube for around 80 days and planted or put back in the woman's womb, and the woman gets pregnant without doing it naturally. So that is okay. Hi doctor, are the signs of infertility? Hi doctor, what are signs of infertility in women? Signs of infertility: when a woman takes long to conceive, and that is a period of 12 months, that is 1 year, we call that infertility. And it becomes infertility if this woman is sleeping or is having unprotected sexual intercourse. Because some of you will say, I am infertile when you're using condoms. When you're using withdrawals and you say, I'm not conceiving. So you must have unprotected sexual intercourse at least 3 times in a week for a period of 1 month for us to say that you are infertile. Mumbathia Zephyrin is saying, can effects that lead a woman to discharge dark water be transmitted to a man? Yes, those discharges, because if it is an infection, for example, if you have a chlamydia, if you have a trichomoniasis, if you have gonorrhea, you can transmit it to your man. Yes, it is very possible. Okay, so we have some people here who have called in live. Let's start with Kabugo Jan. Kabugo Jan, others mute yourselves. Let's first have Kabugo Jan. Ask your question. Tell us what your name is, where are you calling from, and be brief with your question. And again, be very loud so that everyone can hear.
Yes, doctor. I'm Kabugo Jan, currently live in Ngorongoro, Tanzania.
You're in Tanzania. Okay. What's your problem?
Yeah, I gave birth in 2021. Then after 1 year, my son passed away. Like he passed away in December last year. Then up to now, I have not conceived, and I'm with my man, but I failed to conceive. I went for scanning. They told me everything is good. I have no problem. So I'm failing to understand what could be the cause.
How old are you?
Currently, I'm 25.
25 years. Was that your firstborn?
Yes.
It was your firstborn?
Yes.
Okay. Now, have you, the other man you had in 2021, the one that impregnated you and got a miscarriage, is he the same person you have right now?
No.
It's a different person. All right. Does this guy you currently have, the guy you currently with, does he have any child?
Yes, he has 3.
3 children. And
Yes.
and are you sure that these are his children?
He can't get to know because I've not done DNA.
But you know, yes, you've not done DNA, but at least you can look at the children and maybe they have some features.
Yes, they resemble him.
They resemble
Very
him.
well.
All right. So now what I would ask you to do you see your periods monthly? Do you have regular periods?
Yes, exactly. I see the month, even that period you have just talked about, ovulation period, experiencing pain.
You get
too
it.
much
Thank
pain,
you.
I
Thank you.
experience it.
Do you sleep with your man every day, like you have sex at least 3 times in a week?
Yes.
Unprotected. I ask this because I want to be very sure.
Yes.
All right. So now, what I will ask you to do is to go to the hospital and do a test called HSG, hysterosalpingogram. Now that you had a miscarriage, it is possible that the tubes can get blocked. Hysterosalpingogram. Yes, please.
Excuse me, doctor. I said it was not a miscarriage. My boy had grown, even had reached a year.
Oh, all right. Thank you. So what I would ask you, because you only did an ultrasound scan. Okay? You did an ultrasound scan. It is not enough to find problems with your uterus. Okay? So you are going to go on and do an HSG X-ray. Okay? When you do an HSG X-ray, it will show us any problems within your tubes. Okay? Then number 2, I ask you to also do a fertility hormonal assay. Check the level of your hormones. Okay? When you check the level of your hormones, you may be able to know what the problem could be. And also do all those other fertility tests. Okay? Because a scan alone is not enough to tell you the reason why you are not able to conceive. Please try and do several other fertility tests. Go and do what they call a fertility screen. Do a fertility screen. When you do a fertility screen, you will be able to get to understand what is causing that. You may be having a PID. You may be having a fibroid there. You may have gotten an endometriosis. You may have gotten an adenomyosis. What about a uterine synertia? So all those ones can cause infertility. So go and do tests, identify the problem, you'll get the treatment. I hope I've answered you. All right. Thank you so much. And say hi to those Tanzanians. Let me continue with some other people. So I'm seeing some other people here. First, mute yourselves. Don't come in now. I will invite you in 2 minutes. Please mute yourselves. Let me first answer a few questions on YouTube. I will come for you. Please mute yourselves. Mute.
Hello.
Hello, good evening.
Good evening to you. How are you?
I'm fine, and you, sir?
Yes. What's the problem? What's your name? Where are you calling from? And what is your problem? What's your question?
Okay, I have 2 questions to ask,
Be
please.
very fast and loud.
Okay. Number 1 is 31-day cycle. When is actual day that she will ovulate?
That what?
And again, the person that is...
What's your question?
I said
It's okay.
31-day cycle. Which date will she be ovulating?
Oh, you have your
And the
cycle.
second-
How many days are your cycle? Is your cycle?
It's 31 days.
31.
Yes. Sorry, 30.
31.
30. 30.
Okay. So a 30. If someone has a 30-day cycle, I want you to do this.
Yes.
Get 30 minus 18. What do you get?
30 minus 18. 30 minus 18 will give you 12.
12. If you give me a wrong answer, you get wrong dates.
No problem.
If you have poor mathematics, choose this. Okay, again.
I'm not hearing you, sir.
Okay, so then 12 plus 4, what do you get?
12 plus 4. 16.
You get 16. 16 plus 5, what do you get?
16 plus 5. 21.
21, thank you. So now, you want to know your ovulation day, okay?
Yes.
This is your ovulation day, 16th. When you see your periods like this today, that is day 1. Count 1, 2, 3. When you reach on the 16th day, that is your ovulation day, and that is the day you can conceive. That is the day when the chances of conception are high, 16th. But still, from the 12th day up to the 21st day, you can still conceive. They are not safe days. From 12 up to 21, you can still conceive. There are chances of conceiving. But 16th, they are very, very high. You can highly conceive on the 16th day. Then from 1 to 12, you're safe. 21 until you see your periods, you're safe. This is your ovulation day. Thank you so much. Have a nice time. Let's have some other person here.
Sorry, the second one.
Please, I have many people and time is going.
Please.
You'll ask that next time.
Please. Okay, please.
You'll ask that next time.
The second one is the person that is looking for a baby boy. Which actual date will he meet his husband to conceive a baby boy?
Please, next Thursday, come back. You'll ask the question. I have many people here. The lineup is long, and I have to answer everyone. Now I'm inviting only one question. Let me first answer a few people on YouTube, then I come to you guys.
When you used to enter online, you used to enter online
every
Thursday.
Every Thursday, yes. Every Thursday, same time. So we have another question here from Dr. Soyemi Damirale. Dr. Soyemi, where are you? Dr. Soyemi, where are you? Saying great work you're doing, Dr. Uthman. Thank you. Thank you. Dorcas Nakawala is saying, Doc, is breast sore from a week after menses a sign of pregnancy? Yeah, it is possible. It is very possible. Kawala. Then Shafiq Kale, I'm coming for you guys on TikTok. Just give me 2 seconds. Shafiq Kale, hi Doc. Can you share with us your number? No, please, Mr. Shafiq, I don't share my number because when I share it, there are many people that will call on it and it will be very busy and not be able to work. But if you want to have a private chat with me, book an appointment, go to my website, www.druthman.com, book an appointment. I will talk to you privately. You can see that website, it is passing down there. Then another one, the last question on YouTube is saying, please, what can I do to stop high prolactin completely because I've not given birth, but my prolactin is always high. High levels of prolactin are caused by, treating high levels of prolactin, you need to use a drug called carbapenem or bromocriptine and all drugs in that class. Let me have someone called Princess. Princess, how are you and where are you calling from? If Princess is not talking, let's have...
I'm here.
No, I want Princess. For you, I finished.
Hello, sir, I'm here.
Alright, go on. What's the problem?
I asked you which day.
Oh,
which day
no, this is the same person. No. Yana, no, let me have Yama B. Princess, go away, please. Let me have Yama B. Yama B, your life, tell me what your name is and where are you calling from?
Hello, sir.
Yes, hello, how are you?
Okay, no problem. Next Thursday.
I'm fine. I'm
Okay.
Yama. I'm calling from the Netherlands.
You're calling from Netherlands. Be loud, be loud. Dutch people are always loud. Be loud.
Please, I have a question to ask. Can someone get pregnant even though person did not release on him.
No. You cannot get pregnant when the person did not ejaculate. A man has to first ejaculate for you to get pregnant.
Okay.
But you may think, but withdrawal, some people do withdrawal and think they cannot conceive when they do withdrawal. It is possible for you to conceive when you do withdrawal, because sometimes the man jumps out when some sperms have already entered. And also, second round, if you're using the withdrawal method as your family planning method, make sure that you don't do the second round, because after the first round, yes, you can withdraw, but after withdrawing, some sperms remain in the penis. So when you start the second round, those are the sperms that enter first. So you end up conceiving.
Stop. You are on your period, and then like you are done today seeing your period, and then the next day you had sex, but the person did not release on you. So I'm confused.
Be a little bit loud. When you're in your periods, you have sex the next day and the person doesn't release, you can't conceive. For sure you can't conceive if the man will not release. It is not possible.
Okay.
It is not anywhere in the history of pregnancy that someone conceived when a man had sex, did not release anything, and then a woman conceived. No, that's a lie.
What if the person released on you, like, and then after went and released outside? You cannot know it. Or what is all?
You see now you're confused. You're talking about a person not releasing, and you're talking about releasing outside. Are you talking about withdrawing?
I'm really confused. I don't even know.
Okay, tell us the story. What exactly happened? And be loud, please. Increase your volume. Be loud. I'm straining to hear you. I want to help you, but you're not clear. Be loud and tell me what exactly happened.
Okay, what happened was, like, it's a question, and then, like, the person, like, have sex after when she was done with her menstruation, like, done today, and then start having sex like the other day, and then the partner was using like protection, then after the person removed the protection, and yet still continued like that, but after a few minutes the person just done having sex with the lady, and then after release outside, not in on her, but the lady is seeing changes in the body system, and then for the past 1 week. So
now there is a possibility of conceiving there. There is a possibility of conceiving. You see, this man you had sex with the man, then the man, at first you had a condom on, then it was removed.
yeah.
Okay? After removing the condom, probably this man released some sperms. They can release some few sperms, okay? Some little sperms, and then by the time they get out, there is already some sperm drops that have already dropped into the V, and then those ones can be able to impregnate someone. So it is possible to conceive because there is a likelihood that the man released a little bit before getting out. Okay?
So when is the right time to do like pregnancy?
14 days. 14 days, that's when you can do a pregnancy test after sex.
After 14 days.
After 14 days.
Okay, thank you so much.
Alright, and I say hi to those people. Let me have, I have a few minutes. Let's have, this one is called, please, Dr. Betty Kugonza, I just removed the IUD in July. How long am I going to take it to conceive? An IUD is a non-hormonal method of family planning, and therefore for it is immediately. When you remove it, anytime you can conceive. So Betty Kugoza on YouTube, you can conceive anytime from now. Namale Gertrude on YouTube, you say, good evening, doctor, to those who can understand English. Do you have any program for them? Good evening to those who cannot understand English. Do you have a program? Really, my mode of communication on all my platforms is English. So if someone can't speak English, I don't know, maybe in future I'll find a way of getting an interpreter. Alright, let me have a question on TikTok before I go back to YouTube. Who is this one? Is it Sanex? Sanex,
yeah.
Yes, how are you? Where are you calling from and what is your problem?
I'm okay. Good evening, doctor.
Good evening to you.
I'm calling from Uganda.
You're calling from Uganda. What's your name?
Yeah. Sam.
Okay, what's your problem? Be loud and tell us your problem.
I wanted just to ask you that if like a woman aborts a child, a woman aborts a fetus, then after the blood, after she stopped bleeding, then you test after 3 weeks. Why do you test and get that the woman again is still pregnant?
Now, my friend, now this should be to everyone watching. I think this question, thank you so much for asking this question. You've helped many people. Now, when a woman conceives, there is a hormone, there is a chemical which is called human chorionic gonadotropin, which is HCG. And actually, when you're doing a pregnancy test, you test for the presence of that hormone. That hormone will remain in blood, okay? Will remain in the body even after a miscarriage or even after delivery. For miscarriages, it can take up to 40 days. On average, it is 30 days. That's when the hormone goes down, and that's when it can no longer be detected. But some women can go up to 40 days. Therefore, the pregnancy test will remain negative. Some people get abortions. After doing an abortion, they come to you and tell you, doctor, I had an abortion, but I'm testing, the pregnancy is still there. What is the problem? There is no problem. It's because the human chorionic gonadotropin is still present, though the fetus is out. Even after delivery, even after cesarean section, the HSG will remain positive. I think we are clear there.
Can this woman get pregnant when the hormones are showing?
It is
can she get another child?
It is unlikely, especially when that hormone, the HCG, if it is still high in blood, it is not possible for someone to conceive. It becomes so hard. That hormone has to first go down.
Okay.
All right. Thank you so much. Have a nice time. I'm ignoring my people on YouTube. Let me first answer them, and then after that, I'll come to Atinaba. I'll come to you, but let me first finish these people on YouTube. Augustine and Udimbrai, good day, doctor. I am 55 now. Is it not risky if I decide to do IVF? Yeah, there is some risk. Yeah, but you can still go on and do an IVF. You can still go on and do IVF. Justin Narillo on YouTube, you're saying I'm 27 years old. I have breast discharge, waterline milk, like in nature, but when squeezed, my prolactin levels are 13.4 nanogram. Ranges is 2.6 nanogram. Normal menstrual cycle. I'm worried. Thanks. When you have discharge, when the prolactin levels, please mute yourselves. Please, those on TikTok, mute yourselves. You're causing some noise. If you don't mute yourselves, we are going to take you off. Justin Nabiyo, you have breast discharge and the prolactin levels are normal. Then that is not hyperprolactinemia. Then you're likely to be having some other problem. You can have, actually, I would request you to go for a breast examination. You go and do a breast examination. You go and do a breast examination. I request you to go to the hospital and do a breast examination. There may be a problem. Sometimes those cancers start like that, mastitis and so on. Go and do tests to go and check with the doctor, get examined, and find out what the problem is. And by the way, in one of my videos, one of my coming videos, I will be discussing how you can do a breast examination, how you can do self breast examination. Many women don't know that they can do breast examinations themselves, and I'll be teaching that in one of my videos, which will be coming on YouTube. Wisdom Mike, good evening doctor. I have pain during sex. I have ovarian cyst. What can I do? Pain during sex, you have a PID. Go and take antibiotics. You get fine. I am not hearing you here, doctor. Lydia, you're not hearing me. What's the problem? Are we having a problem with our speakers? Okay. Let me have Aftinabu. Aftinabi, where are you calling from and what is your problem? Be very fast and louder. Everyone needs to hear.
Okay. Can you hear me?
Yes.
I'm calling from South Sudan.
Yes, you're calling from South Sudan?
Yes, I did an HSG test and one of my tube is blocked. So I was thinking of doing an IUI. So the doctor told me that he's going to concentrate on one of the open tube. So he told me that I'm supposed to come back on day 3 of my period, and then I get an injection and start my letrozole. So my question is, doctor, what is that injection that I'm supposed to take before taking letrozole?
Now, you see, I am not in position to tell you the type of the medicines you're going to take. Because you are under management, there is someone managing you. He has done tests I may not know. He has done examinations I may not know. Now he's the one is in the best position to tell you the medicine you're supposed to take. Because I have a different protocol. Everyone has, there are different protocols we follow. And you may find that someone is following A, I am following B. And I may give you advice of B, yet you're on A. So I will be wrong. Professionally, ethically, that is not right for me to tell you the medicine you're going to take, yet you're already under care of a very good doctor. So I would advise you.
I got an email. I received an email, so I did talk to him direct, face to face. So
Yes.
that's why I was
Thank you.
thinking. He told me I was taking letrozole before, and I wasn't making a lot of follicles. So that's why he said he's gonna.
Yes, he sent you an email. I request you to reply him by asking him that type of injection you're going to take. Because I will tell you a different injection from what he intends. There are many medicines. It's like telling me painkillers. There are several painkillers.
Okay. It's not that I want you to tell me the specific injection, but what are those injections? What is the work of the injection given before letrozole?
Sometimes someone wants to stimulate production. Okay? Someone wants to increase or to improve the egg quality. So there are a lot of reasons. Maybe someone wants to increase a certain hormone there. Maybe progesterone was low, maybe estrogen was low and wants to increase. That's why different people will give you medicines depending on the various tests they have done.
Okay.
Yes.
Okay, thank you. And what is the success rate of IUI with one blocked tube?
It is low. It is low as compared to IVF.
Okay. Okay, doctor.
All right.
Thank you.
Thank you too. Have a nice time.
Thank you.
Okay, let me now have another question from YouTube. Please, doctor, ovulation date calculate the irregular period. What question is this, please? Pinku on YouTube, Pinku Sahu. Please ask your question clearly. I will answer you. Wisdom Mike, thank you, sir. Is it possible after surgery I can get pregnant? I'm trying to conceive. Yes, it is possible. After surgery you can get pregnant. There is no problem. Rose Natwera, hi doctor. I'm now 1 month. 1 month missed period. At first I had light headache. Then from there I started to have weird feelings and other signs in the tummy. Am I pregnant? It is possible that you're pregnant. Just can carry out a pregnancy test to confirm whether you are pregnant. So let me have this lady up here. What's the name of this one? There's no name. But tell us where you're calling from, what and what your problem is. The lady on top. Okay. If you're not there, let's continue with the question. Hello, how are you? Where are you calling from and what's your name?
I'm called Sharon.
Sharon, where are you and what's your problem? Okay. We have Chioma. I think your network is bad. We have Chioma who's saying good evening to Mildred. So we are left with 10 minutes. We have 10 minutes. We shall be closing our live. Mildred, now if the discharge is white, if the discharge is white, it's likely to be candidiasis. Eva at 993. Hello doctor, I'm Evelyn from Kenya. Doc, I have delayed fertility and I'm 30 years and always have irregular period and I don't have any mass in my uterus, only breast tenderness and low sex drive. Please help. That the way you're explaining your problem, that is hormonal purely. Do a fertility hormonal acid. Low sex drive, you're talking about estradiol. Irregular periods, we are still playing with progesterone, prolactin, estradiol. Do a fertility hormonal acid, identify what is causing the problem. Placing a bee, but is it going to change to my normal cycle again so that I can be able to know when I'm ovulating? Now I think you're the one who asked a question concerning Depo-Provera, a 3-month injection. Yes, after a certain period of time, the periods can normalize, and if they don't normalize after 6 months, then you do tests and normalize them. Hello doctor, how many days, all weeks, a day, the whole process of IUD take? Hey, an IUD can be inserted within 10 minutes, no, within 2 minutes. When you come to the hospital, when an IUD can be inserted within 2 minutes, done and dusted. 2 minutes, an IUD can be inserted. Then maybe you're asking when to start sex after putting an IUD. When does it start working? It starts working after 5. Okay, then Duga, Baraji, that was pheromone. Yes, what are you saying? You got off, your network was down. How are you? Where are you calling from? What is your problem? Say your question, please.
Hello.
Yes, be loud, be fast.
Hello, doctor. Hello, doctor.
Hello, how are you? Be loud, be fast. Get your question on board. No, you don't have network. Austin Precious is saying hello, doctor.
How are you?
This person is network. Ujeko doesn't have network. Get them off.
Hello, doctor.
Yes, how are you? You're not speaking. You're just saying hello.
I am speaking, doctor, but I don't think that you hear me.
Please go on.
I'm called Sharon. Hello, doctor.
Let's have Kemikisha Winnie saying hello, doctor. I want to ask how many weeks for delivery? Is it 36 or 40 weeks? The maximum is 40 weeks. It should not go beyond 40 weeks. When it goes beyond 40 weeks, we call that postdatism. Then Miss P Vlogs is saying, hello doctor, I have been diagnosed with ovarian premature failure. I'm trying to conceive. Thank you. Welcome. So I don't know what the question is. I don't know. Please, Miss P Vlogs, and enlighten us your question. That one has no network. Please speak up. Get me know your problem.
Doctor, good evening. I'm called Sharon. I'm calling from Chotera. I went to the ultrasound scan and that they told me that I have a low ovary amount. What should I do?
An ultrasound scan cannot show ovarian. The pelvic ultrasound scan, where they put a jelly and put a probe, something like this, on your tummy. That one.
Yes.
And he told you that you have low ovarian reserve?
No, they told me that the ovary, I have low egg or something production.
Not possible. An ultrasound scan, just a normal, these normal pelvic ultrasound scans will not be able to enlighten you with that. So that is not the proper test. A proper test to look at that, maybe if it was a transvaginal ultrasound scan, or if you're using
So what should I do?
So what you're supposed to do, you will do a fertility hormonal assay. You will be able to find out if you have low ovarian reserve. That what?
No, what should I do? Because
you need to do a fertility hormonal assay. Are we together?
Yes, doctor.
Yes, you need to do a fertility hormonal assay. That's what that's how you get the diagnosis.
And I have imbalanced periods.
You have a what?
Imbalanced periods.
Yes, so that's why I'm telling you to do fertility hormonal assay and you get
Like
answers.
irregular.
Yes, yes. So what you're supposed to do is to carry out a full fertility profile, okay?
But there is no medication I can take.
Your what?
Yes. There is no medication I can take apart from that one.
So that is not a medication. That is a test which will confirm your diagnosis, which will find out. You need to first get examined, fully examined. Then you do those tests, identify the problem, and get the solution.
So should I come at the hospital?
It's okay, you can come. Monday and Tuesday, that's when I'm available.
Okay, thanks.
Alright, Nabanja said, Nabanja Mariam, hi doc. My baby is now 7. Nabanja on YouTube, what did I say? My baby is now 7. Oh, the question has gone. Hi doc, my baby is now 7 months old since I gave birth. Just yesterday I got my periods back, but I'm worried of getting pregnant so soon. What natural birth control can I use? Abstain. Abstinence is the safest, most accurate method of family planning. Natural, if you're talking about natural. Abstinence. But if you can't manage abstinence, then another natural method is withdrawal. But withdrawal, if you are married, you stay with a man, withdrawal may not work. Withdrawal can work for someone who is going to meet the boyfriend once, and maybe all someone is meeting the other one and they are going to have only one round. But if for you are having 2 rounds, you stay with your man every day, withdrawal may not be effective. Another natural method of family planning is calculating your safe days. Calculating the safe days, I've always talked about how to calculate the safe days. I hope you know that. Those are the methods you can use. We are left with 5 minutes and I'm winding up. This one is saying, Jado, oh, I still have many questions on YouTube. Let me try a few. Jebudol Kaliang is saying, Doctor, I feel nipple sore, but no period. Then after 14 days, clear and slippery discharge. What does it mean? Yes, that is ovulation. That is the ovulation. Doctor, I'm having regular pregnancy. I'm having, this is who? Madame Josie. Madame Josie is saying, Doctor, I'm having pregnancy, but is moving only when I'm studying. Doctor, that is okay. Especially when the pregnancy is still, when it is first trimester, second trimester. You not be able to feel it when you're lying down. So it is okay. That is okay. There is no. You don't need to do anything. Joanne is saying, I think I will come to your hospital too. Kenya, isn't it far to Uganda? No, it is not. Kenya is not far away from Uganda. Just come. Then Nezim. Joanne, I'm not ovulating, doc. What can I do? Do a fertility hormonal assay. Identify the level of your LH and FSH. Then we are winding up. Hi doc, I had surgery. Nezima Iman on YouTube, you're saying, hi doc, I had surgery on January 20th, 2023. Is it possible for me to conceive next year around March? It is okay, it is possible, there is no problem. Quincy, you've put someone else. We are winding up. Chacha is Quincy Chacha is saying, good evening. Please, can a woman at 60 years get pregnant? Oh my friend. A woman at 60 years. But there are chances. There are chances. I know at 60 years you're not menstruating, but we can try something. It is possible. Don't lose hope, Quincy Chacha. It is possible. So you're the last one to be answered on TikTok. You're Mary Jenna. Be very loud. Tell us your name, where you're calling from, and your question. Be very loud and very fast because you're winding up. Good evening, to be loud.
Yeah, I'm speaking from Italy.
You're calling from Italy. What's your name? What is the problem?
Yes, the problem is I went for ultrasound and the doctor said the length of my uterus is
We are not hearing you. Be very loud, or else you'll join us next time on Thursday. We shall be live again because we are out of time and you're too low.
Say what?
Alright, please join us next time on Thursday. We are going to be live same time. Join our live. You ask that question, I'll be able to answer you, but time is up. And you're too low, we cannot hear you. Next time on Thursday we shall be live. Make sure that your device has a good volume so that we can hear you and give you a good answer. So, alright, let's have the last question from YouTube. Doc, is it possible for a woman to get pregnant when it's about to start period in 2 days and it starts period? No, that is not possible. You cannot get pregnant 2 days before your periods. That is not possible, and it will be history it will be a miracle in medicine. Sehuro Mbule, your YouTube, you're saying, what happened if a person sees her period on 2nd of this month and sees it again on 21st of this month? Is it normal? No, that is not normal because that is less than 21 days. Hi doctor, can supplements help get pregnant, please? Which question is this? Gift. Good evening, doctor. A woman who have endometriosis, can she get pregnant, and what supplements can help to get pregnant? Supplements to get pregnant, please, I invite you, go to my YouTube. There is that video, one of my last videos. I had a video talking about vitamins that can make someone get pregnant. Endometriosis has to first be treated, of course. What? Hi doctor, why am I seeing menses different cycles? That is regular period, and that is likely to be a hormonal imbalance. So we are closing. This is the very last question. I will get the all symptoms and finally period of no. These questions are very many. Thank you so much for those of you who have joined my live today. Join again next Thursday same time. And for those of you on YouTube, don't forget to become a member. Go join, become a member. There are a lot of perks, and one of them, you can have a one-on-one live chat with me. Those on TikTok, thank you so much, and all social media platforms, thank you so much. And those that have not answered their questions, please come back next week on Thursday and ask those questions. Be very fast, come early so that I answer your questions. I'll be having only 1 hour every Thursday to answer your questions. Thank you so much. Have a nice time. God bless you.
Ask Dr. Othman on Sawa Walk.